So, hi, Professor Jiao. You're here today to talk about the use of the Da Vinci single port surgical robotic system for use in HPB operations and distal pancreatectomies. Have I said that right?
Absolutely right. Yes.
Oh, great. First try. Um, First of all, before we talk about the Da Vinci single port, can you just introduce yourself and just say a little bit about your role?
I'm a professor of surgery at the Imperial College and also working at Royal Marsden Hospital. Privately, I do some work at Cromwell Hospital. My role is really leading the field of HPB surgery, and also I started robotic HPB surgery in the UK and have done over 1,000 HPB robotic cases in the UK, the largest number in the UK and a few centers in the world.
Wow. Can you go into what is an HPB operation and also what is a distal pancreatectomy?
So HPB operation refers to any surgery on liver, pancreas, and gallbladder. Unfortunately, all the organs are very hidden, very difficult to access. As such, the operation itself is highly challenging and difficult. Furthermore, all those organs are surrounded and also contain a large number of major blood vessels. As a result, the surgery itself is highly challenging and difficult, often requires a lot of training before one can be confident enough to do HPB cases. The distal pancreatectomy is part of operation to remove the body and the tail of pancreas, mainly for cancer. Increasingly, we do operation for benign and pancreatic tumor, as well as some chronic conditions such as chronic pancreatitis. Pancreas consists of body, tail, and head. At the body and the tail pancreas, unfortunately, it is intimately related to the spleen. As a result, the spleen is often removed automatically by most surgeons, as technically it's very difficult to separate the vessels to the spleen from the pancreas. Automatically, people get spleen removed at the time of pancreatectomy, distal pancreatectomy, regardless whether clinically is indicated or not, due to technical reasons. However, spleen is a very important organ. It has a special function to protect people against three major bacterial infections. As a result, that if one spleen is removed with distal pancreatectomy, they are automatically prone to increased risk of bacterial infection by 6 to 8 fold. So lifetime risks after removing one spleen is increased significantly by 6 to 8 fold for serious bacterial infections such as sepsis. So when we talk about distal pancreatectomy, we always talk about the splenectomy as well.
And what improvements or benefits to the procedures have you seen from using the Da Vinci SP?
Now, Da Vinci SP is a major landmark development for minimally invasive surgery. As you're probably aware, over the last 2 decades, the major improvement in surgery has been minimally invasive surgery. Traditionally, it's done with laparoscopic instrument, but recently it has moved on to robotic instrument. However, the Da Vinci robot has multi-port with at least 4 arms. That means 4 incisions as far as the patient is concerned. So the reason for this being a landmark development is because it uses single incision. So it's one single incision. So by definition, it's less traumatic, a much better cosmetic result, and offer patients much quicker recovery compared with conventional open operation previously, and lately laparoscopic and multi-port robotic operation. For example, for laparoscopic and robotic distal pancreatectomy, one will need to introduce at least 4 or 5 instruments, i.e., 4 or 5 incisions in the upper part of patient's abdomen. Although they're small, nonetheless, 4 or 5 incisions. Those incisions can cause pain after surgery. The latest Da Vinci SP allows a single incision through which we can introduce camera and surgical instruments for us to perform complex operations. Since its introduction, it's mainly used for prostate operation because urologists have standardized their prostate operation to use Da Vinci only. For the first time at Cromwell, we have performed complex liver and pancreatic operation using Da Vinci SP in the UK, and also only a handful of cases have been done in non-urological cases in the West.
And were there any challenges that you faced when introducing the robotic systems for these type of surgeries? And if so, how did you overcome them?
Of course, it's new technology. Everybody has to learn how to master the technology. As a surgeon, we have to be trained completely different type of training and learn this in order to be proficiently enough to apply the technology to patients and clinical practice without causing harm to patients. I must say here, I have to thank our CEO at Cromwell, Philip Luce, and his team. They are extremely dynamic and visionary to provide and establish the platform for the latest Da Vinci SP system at the Cromwell Hospital. Intuitive Surgical has provided excellent training and support throughout for surgeons who are interested in Da Vinci SP to make surgical single incision robotic surgery possible.
And I know you touched on it a bit on the previous question, but can you go into a bit of detail about the benefits of a single port surgery compared to multi-port surgery?
So compare with the conventional Da Vinci Xi system, which is a multi-port robotic surgery, Da Vinci SP allows much quicker docking of the robotic system and reduces number of surgical incisions from 4 to 5, or 5 to 1. As such, the pain control is much better post-operatively. So far, I've done over 20 cases. The pain control much better in terms of requirement for analgesia, quicker return to functional activity prior to surgery, as well as number of analgesics required for pain control after surgery, much better compared with the conventional Da Vinci Xi and also laparoscopic surgery. Of course, for a much better cosmetic reason, because there is only one single incision. For example, I did a patient recently for major liver resection involving the left lobe of liver, and the tumor was extracted from the same incision. The patient afterwards at follow-up asked me, did I really take a liver tumor out from him through such tiny incision or hole, which he described, and he said he could hardly see the surgical scar. So clearly there's a benefit of a single incision for patients in terms of cosmesis and pain control post-operatively.
And now that you've performed the first distal pancreatectomy using the Da Vinci SP in the UK, what did you learn from this experience that would help other centres that are considering adoption of the technology?
I think this is a future landmark and development. In my practice, my standard operation will be robotic surgery. For distal pancreatectomy, definitely will be robotic surgery, with no doubt about that. Based on my own series, over 1,000 robotic operation, I published my own data that there being a zero conversion rate to open operation for robotic distal pancreatectomy. I have to say the most important of all for robotic distal pancreatectomy is that it offers the best chance for spleen preservation. So far, with the intention to keep one spleen, I have not lost a single spleen during robotic distal pancreatectomy. This is a significant in terms of reducing post-operative complications and the long-term impact of splenectomy. This Da Vinci SP will further strengthen the fast-track surgery to benefit patients and healthcare providers. I think we should standardize the treatment, reduce the number of days post-operative stay, and reduce surgical outcome by benchmark by using robotic instrumentation and robotic surgery itself.
And finally, do you think robotic surgical systems will become the norm for every type of surgery in the future, or is it just for certain cases like this where you think it'll be used?
I think there's no doubt the future will be robotic surgery. It will replace any other form of keyhole and minimally invasive surgery. In my practice, I already perform over 95% of HPB cases robotically. I rarely do open surgery for complex robotic surgery. Having performed the first robotic Whipples and major liver resection robotically, I think we can introduce a robotic surgery to all the other specialties and replacing current keyhole operation. Of course, it comes with the cost and access to the platform of robotic surgery. So if we have, we can reduce the cost of Da Vinci, and also if we provide access to the Da Vinci, I'm sure this will replace all the other forms of minimally invasive surgery, and to benefit patients and also healthcare providers to reduce the cost related to inpatient hospital stay and management of post-operative complications.
Well, that's it for my questions. I'd just like to say thank you very much for your time, and this has been fascinating, and I'm sure the viewers will be very interested to hear what you've had to say. Is there anything else you'd like to add before we go?
No, thank you. Once again, I thank for Cromwell team for providing robotic access back in 2017. Since then, we have had a very busy years, and including all specialties in London and in the UK. I have to say West London is the most active part of the world, and also in the UK, to provide robotic surgery, both at Cromwell Hospital as well as Royal Marsden Hospital, benefiting both private cases as well as NHS patients. I think this is the only way to drive healthcare forward. Once again, I thank the team at Cromwell, especially Philip Lewis, for making everything possible.
Brilliant. Thank you very much.
Thank you.